GNM Bangalore last few seats available at GRV School of Nursing. Hurry, grab this opportunity. For details, visit Good Shepherd Education Trust opposite DRPR office, Lower Lachmere, Shillong, or contact the numbers below. Menteri Ketenaga Social Welfare ke Jylla Bapa Lingdo ulakantu yaki panpa ki kenhun ban Kiar na kabaya kenno ya ke sorkar kabaya khun banyale Pyrshah Droks Henry habadan keno ke jingduna kidai ban a jingmut Iasnohkti lang. Ketenaga Social Welfare ke Jylla kalapan long ya ke jingathir halor kumno banyale Pyrshah Droks ringkat ke jai trailang ke Indian Drugs Users Forum bat ke Meghalaya Drugs Users Forum Havivanto Hotel menta ke sngi. Ulong ba ke jing jylla Droks kala jubor hado kata-kata hado ba lawan rong lajan haman kitliu ying. Ulong ba menshwa ke Jylla Meghalaya latip kum ke jaka yad Droks shakiwe ke Jylla. Hindrai menta kala long ke jaka ni ka ktem Droks upalawan rong shaman ki kendong ke Jylla. Ulakhot ki kenhun baper bakin wan manyatrailang bat ke sorkar ban bekrat ya uniu yak chakor uba pintaron ki samla ya ke yeng kesem bat ke imlang ke salang. Iakynnoh ke jingathir jengmut la penlong lembaga drug reduction eliminate and action mission shibinta jong ke jing rakhe ya ke sngi Pyrshah Droks ha ke porthe shwa Iakynnoh la yoru ya ke jingkren no commissioner Ketenaga Social Welfare uprabin bakshi bat ki wede lawan men shimbinta ki kenhon baper ha ke ne ke jingathir ke ban ai jingmut sha ke sorkar halor kumno ban yakhun new drugs.
The theme of the World Drugs Day 2024 is investment in prevention. It is a call to action that resonates deeply with our mission in Meghalaya. It highlights the crucial need to prioritize preventive measures as a foundational strategy to address and mitigate the challenges posed by drug abuse. Drug abuse is not just a personal affliction. It is a societal challenge that affects every facet of our community. It disrupts families, it undermines economic stability, and hampers social development. In Meghalaya, we are acutely aware of the challenges posed by drug abuse, particularly among our youth. The allure of drugs can derail promising futures and lead to a cycle of dependency and despair. Therefore, our commitment to prevention is the cornerstone of our strategy in combating drug abuse. By investing in promotion, we are making a commitment to the health and well-being of our citizens, especially our young people. Our goal is to create an environment where individuals are informed, resilient, and supported, thereby reducing the risk of drug abuse before it begins. We are also working on educational initiatives. Our prevention strategy includes comprehensive educational programs aimed at informing our youth about the danger of drugs. These programs are integrated into our school curricula and supported by community outreach efforts. By providing young people with accurate information and practical skills, we empower them to take informed decisions and resist the pressures that lead to drug abuse. We also invest in community-based programs that promote healthy lifestyle and provide constructive alternatives to drug use. These programs include sports, arts, and cultural activities that engage young people and help them develop a sense of purpose and belonging.
Today, I could see a number of you coming back to another deliberation invited by Social Welfare Department, which means that the trust deficit has somehow been mitigated. We are coming closer to a point of realization. Because the last time around, I remember one of the leaders of the Dorbashnongs asking us whether we are here just to have a cup of tea with you, or do you mean business? I think today we have shown that we do mean business. No amount of developmental activities, no amount of investment in tourism, no amount of investment in the road sector can yield the desired results if all our initiatives are towards facilitating and creating infrastructure for a generation of drug addicts and alcoholics. It would defeat the very purpose of even having a government and a system of governance in place. So today, I'm happy that I could sense that guarded optimism which is evident in all of you coming here together. And more importantly, we have listed as a subject immediately after the vote of thanks a panel discussion where the discussion centers on legal provisions and policy advocacy in regulating drug use. NDPS Act, PIT NDPS Act, where our panelists include a senior advocate, Srimati Trupti Tandon, senior advocate of the Supreme Court, and Mrs. Tashlin Karbeteng, district and sessions judge. A major gap in arresting the trend of the resurgence of drugs and the emergence of drugs culture in Meghalaya is the need felt by all stakeholders that somewhere there are gaps in implementing the law, that there are striking gaps that make it possible for people to get away with trafficking, and that the laws are such that they are more for the traffickers and more against civil society. Intervention of legal experts to speak on this theme, and I would encourage all of you to pay attention to the presentations and also come up with suggestions, queries, and engage yourself fruitfully with the discussion. Friends, the fact that today Meghalaya has moved to a realization that we need to escalate, we need to elevate our engagement on the problem of drug trafficking and drug use is a timely reminder that society has the choice to either be a victor or be a victim of circumstances.
That when punitive measures are taken to control drug use over public health and human rights, there is a profound impact on health and well-being of our communities, leading to increased rate of HIV, viral hepatitis, overdose, and other related harms. It closes the door for those drug users and their family to openly seek help to access to harm reduction services, treatment, and rehabilitation. The report on magnitude of substance use in India 2019, published by Ministry of Social Justice and Empowerment, suggests that there is an estimate of 8,54,326 people who inject drugs in India, of which 1,49,866, totaling 18%, are from the Northeast India. Meghalaya is estimated to have a number of 11,420 people injecting with drugs. We need to understand whether we have enough facilities to accommodate this number of people and provide them with treatment options. The HIV prevalence among injecting drug use in India is at 9.03, which is the highest among any typology. Meghalaya has 11.48% of HIV prevalence among injecting drug users, which is above the national average of 9.03 and the second highest HIV prevalence state in Northeast observed among injecting drug users after Mizoram. Source of the report is from NACO Sankala 5th edition report. As we observe the World Drug Day with the theme, the evidence is clear, invest in prevention. There is a need to have effective drug policies grounded on science, research, compassion, and full of respect for human rights. Primary prevention policies need to be developed both at national and state level to empower youth and equip them with knowledge, skills, and resources to say no to drugs and become agents of change in their communities, advocating for drug prevention initiative and amplifying their voice in the conversation. We need to invest more on research to understand various behavioral and psychological issues faced by adolescents so as to develop policies planned to address their needs. Early intervention should be planned for people who are in their initial drug use so as to discourage them from becoming dependent on drugs and also minimize the harm associated with drug use. For those who are already dependent to drug use, we need to treat them on a public health perspective, as drug addiction is defined as a disease by American Medical Association and World Health Organization. There are thousands of drug users who have availed drug treatment service and are doing well in their life and are actively contributing back to the society.
To be done, what was lacking all along was community participation. It was there, but it was limited to efforts like de-addiction and counseling. But for us to proactively engage with the community would be to get the community to be part of policing, which is why the very important missing link that this government has finally been able to address is the need to have the community, leaders of the community, actually assisting the police in enforcing laws against drugs. For instance, the BITS NDPS, which is currently in effect, cannot be effectively engaged with unless we have community participation, which is why today the Dorbas have been requested to come up with any further suggestions on the framework of the VDP. We have made available to them copies of the act that governs the formation of VDPs, and within end of this month we should be able to collect all suggestions in writing and then start forming and reviving the VDPs. As of date, we have just 11 active VDPs in the city of Shillong itself, and a vast number of localities remain uncovered. But as you can see from the response to the meetings last time and today's symposium, the response has been very encouraging, and we expect them to form these VDPs in line with the provisions of the law. It's a multifaceted scenario where we not only address it as a crime to be detected and checked, but also as an initiative that has to begin from the family, which is why you will see that we have engaged civil society, faith-based organizations, and Dorbarshnongs. The most effective instrument at the local level would be the Dorbarshnongs, and we have sought their active participation. We have gone across the state, and right now as we speak, This World Drugs Day is being observed throughout the length and breadth of Meghalaya. Awareness programs have been organized even at the level of hamlets and villages. So we are proactive as a government. We in fact have, as I mentioned, we have solicited their opinion on the current framework of the VDP. We will also be accessing funding from the ministry, from Government of India, and we should be in a position to incentivize volunteers of these VDPs. Was earlier revealed to you, Meghalaya has an HIV rate of 11%, while the national average is 9%, so it's slightly on the higher side. In our counseling centers, like the one that we have at Meghalaya, the number of participants, around 30 of them, all of them also received training in various crafts and arts, which they learned in the course of their stay at the addiction camp. And today they all have been empowered one way or another with the training that they needed. With the realization that we need to improve coordination and convergence between various government departments, that we created a mission called DREAM, which is led at the state level by the Honorable Chief Minister of Meghalaya. DREAM involves the departments of social welfare, health, home police, and education. So it is a collaborative effort meant to minimize any possible gaps in the functioning of various departments and to strengthen the collaboration between the various departments.